Do you have a handle on your blood pressure? Hi, this is Dr. Dave Yachter, the chiropractor. In this episode, you'll begin to discover the easiest way to get a handle on that high blood pressure. The reason why this is important is because uncontrolled high blood pressure can lead to many health complications, including heart attack or stroke, aneurysm, and heart failure. It can also lead to weakened and narrow blood vessels in your kidneys and your eyes, memory loss, and even dementia. So this particular subject is very important, and most are well aware of the consequences, but all too often, I've seen the side effects of the treatments become far worse than the disease itself. So what are some causes of high blood pressure? Well, we know that smoking, being overweight, obese, lack of physical activity can contribute to this. Too much salt in the diet or alcohol consumption. Stress is a factor. Older age, as we get older, our blood pressure, especially our systolic, tends to rise. And genetics can play a part in this as well. Also worth mentioning as a cause for high blood pressure is subluxation. Subluxation is when the top vertebrae in this particular scenario would shift out of alignment and put pressure on the brainstem and or the spinal nerve at the C1 level. And this is a cause, a known cause or a causative factor for high blood pressure. So this is why when people get adjusted, chiropractic patients receive adjustments. It is a very common report that I hear that the blood pressure does go down. And in many cases, it enables our patients to reduce or even get off their medications as a side effect of correcting the cause of their high blood pressure. What are some symptoms of high blood pressure? Well, the typical symptoms usually come in the form of severe headaches, dizziness, nosebleeds, fatigue or confusion, vision problems, chest pain, difficulty breathing, sometimes irregular heartbeat. These are all the most common signs and symptoms of high blood pressure. Sometimes, in extreme cases, even blood in the urine may be present. And the common treatments that we usually see for this type of condition, where the blood pressure is unusually high, the typical standard treatments you and I know usually come in the form of medications. One of the medications, which you've probably heard of, some of you may be taking currently right now, hydrochlorothiazide, which are basically water pills, medications that help your kidneys eliminate sodium and water from the body. And some of the most common side effects include increased urination and sodium loss, sometimes dehydration. Diuretics can also cause and affect your blood potassium levels. If you take a diuretic, your potassium level can drop too low, which can cause life-threatening problems with your heartbeat. Another particular high blood pressure drug would be an ACE inhibitor, a common medication, which you probably heard of. That's an ACE inhibitor is lisinopril. And this is used to help relax the veins and the arteries to lower your blood pressure. ACE inhibitors prevent an enzyme in your body from producing something called angiotensin II, which is a substance that narrows your blood vessels. And this is something that your body does naturally when it needs to raise the blood pressure in certain situations. If you're under stress or you need to move your body or you need to move quickly, or in a fight or flight situation where your body may need to adjust the blood pressure and raise it for a certain purpose, angiotensin II would be used intelligently by your body to actually do that. So you can see how this medication actually hacks the body's ability to do that from the standpoint of the concern that it can cause high blood pressure and force your heart to work harder. So that's the reason why they use that blood pressure medication. Angiotensin II receptor blockers is another high blood pressure medication. Very, very common, very widely used medications like losartan and valsartan. These were two of the most common blood pressure medications that were pulled by the FDA a couple of years ago. If you remember, many of them were recalled for having cancer-causing impurities in them. And then the final one worth mentioning is calcium channel blockers. Many of you have heard of amlodipine, very common and widely used as an effective treatment for hypertension as well as angina. Several studies have raised questions about their safety, suggesting that calcium channel blockers can increase the rate of myocardial infarction and death, particularly in patients with heart disease. So there's always cause for concern when taking these prescription drugs. Not that they're not necessary, obviously, in certain situations, certain people, certain conditions. But again, the question always comes back to how long can your body sustain those effects before it causes other health problems? Because other common side effects of hypertension medications could be constipation, dizziness, headache, fatigue, drowsiness. Actually, these mimic the symptoms of the disease itself, of high blood pressure. Nausea, vomiting, diarrhea, cough, low blood pressure, muscle or bone pain, rash, and sexual dysfunction. All very, very common side effects of the most common blood pressure medications. So again, the important question here is, can high blood pressure be addressed without the risk of medication side effects? And the answer is yes. Lifestyle modifications, as well as certain supplements, can in fact have similar application as many of the prescription drugs we've talked about here, which are used to address high blood pressure without the harmful side effects. So you can get all of this as far as learning about what to do instead, what alternatives there are, as well as how to reduce your risk of heart disease by 90%. Get better control of your blood pressure, your cholesterol naturally. We're going to talk about all this at the workshop. Reverse type 2 diabetes, learn about the most powerful heart-healthy foods and nutrients. So you'll get all this and a whole lot more at our upcoming Heart Smart Nutrition Workshop. It's coming up this Monday, September 13th at 6 o'clock. So if you'd like to join us, you need to click the registration link found in the description box below, or call our office with the number on the banner below. Seating's limited, so please register now to get your free tickets for yourself, your family members, friends, loved ones. If you're in our office now, just simply stand up, walk over to the front desk, and put those names down so we can reserve those seats, because seating is limited. Thank you so much for joining me today. I love and appreciate you. God bless.